One of the cardiology pharmacology that I love very much is statins. They are used for cholesterol, very important. The content is straightforward. When they ask you a question in the NCLEX or nursing school, straightforward. You can predict what they're going to ask you. So this video is to emphasize those information, and then we practice some questions, show you where the question most likely will be. Like, you expect to get one question on it at least, because it's very common. A bunch of people are on it. We always call it statins. So that's what everybody call it. I don't call it like that. I call it statins, because if you look at the last name of them, it's actually Statins. So let me take the X from there, but most of it is called statin. Everybody call it statin, but it's Statin because all the last name have that kind of information there. Second thing, what does it do? It's going to block this enzyme. It's called HMG-CoA reductase. Okay, reductase inhibitor. So they block these enzymes. Unfortunately, these enzymes work at night. That's the way you can think about it. Work at night. So it makes his cholesterol at night. So cholesterol at night. So this is how it does its job, HMG-CoA, and it does its job at a particular stage at night. So it's going to block these enzymes. Because of that, if you have to give it to somebody for it to work, give it to them at night or bedtime. That's the first thing. Second thing they want you to know is the example of them. So I told you they are called statin, but I call them statin because look at the names. Examples, first one, common one is Atorvastatin. You see, Atorvastatin. I separate them. It's not just statin. Atorvastatin. The next one is Simvastatin. That's the actual name. Another one is Rosuvastatin. So if you figure like that, you can see that when they give it to you, either you stick with the statin or the va, right? There's a pravastatin. And the last one is Lovastatin. So these are example of common one NCLEX or nursing school will probably will give it to you, right? These are the common ones you may see. What do you need to know? Like I told you, it's a straightforward content. It's going to block HMG-CoA reductase, which is responsible for controlling cholesterol. How is cholesterol and classified in our system? We have high density lipoprotein. Then we have low density lipoprotein. We also have triglyceride, and then total cholesterol. All of them add up to give you a total cholesterol. So it's going to act to perform and trying to decrease these element of your cholesterol. Unfortunately, what it does with HDL is the good one. So increases this one, but decrease LDL, and decrease triglyceride, and in effect, it decreases overall cholesterol. What is the aim of this? If you have coronary disease, so if you have coronary disease or if you have diabetes, what is the aim of this? We want to get you to a place where your HDL is at least greater than 50. Your LDL is less than 100. Your triglyceride is less than 150. And your cholesterol, total cholesterol, right, is less than 200. The caveat is if somebody is taking a medication and then you give it to them. So example, you may see in the NCLEX, somebody is taking and his this and his HDL is basically HDL. This one we want to make it greater than 50. His HDL probably is less than 40, and LDL is greater than 160. Triglyceride is greater than 200, and total cholesterol is greater than 250. If I give it to you, you come back 3 months and have HDL is almost like 51. LDL is still greater than, it's maybe 140. Total cholesterol is like um, maybe triglyceride is like 160, right? And then total cholesterol is probably, this is equal to probably it's like 200. You still have to continue because they're moving in the right direction. Don't say it's not where you want to get it. It's just 3 months. Give the individual another 3 months, sometimes 6 months, to be able to see if you need to increase the medication or continue the current management. So don't fall for that. Okay. What did the NCLEX want you to know? Keywords. These are the buzzwords that they want. Key fact. This is key point. I want you to know when they ask you a question, this is what it's going to be. One, take it at night. Okay. Because that's where cholesterol. So bedtime, right? Two, you got to monitor the individual AST, ALT. It affects your liver. And so this can be checked every 6 months, right? Every 6 months is good. The most important thing is you got to check for muscle damage. So that is what we creatinine kinase. So CK level, we got to monitor. If it's very high, you worry about rhabdomyolysis, right? Rhabdo. This is a problem. Rhabdomyolysis. This is what work. And you will see dark urine and low urine output and the creatinine going up. That's a sign of creatinine rhabdomyolysis. So that's what you want to do. They should also avoid grapefruit juice. This is also teaching that you have to provide them. Number one teaching you provide them, apart from the rhabdomyolysis, report any muscle pain or weakness. That's the signs of muscle breakdown. Of course, not good in pregnancy. So you cannot use it in pregnancy. These are the things you see in selected apply questions teaching at night. Check CKA level. And if you see rhabdomyolysis, and what does that mean? Dark urine, low urine output. They should avoid grapefruit juice, report any muscle pain, weakness, and not good in pregnancy. You also should teach them to increase fiber. This will help decrease your cholesterol. It's been well known fiber decreases cholesterol level. So you tell them to increase that. There's some common side effects associated with this GI upset. Don't worry about it. Don't worry about it. They may get some headache. Don't worry about it. They may tell you they have a hepatitis, right? Don't worry about it. Those are all, or the glucose can go up. Don't worry about it. They are not the B-sharp movement. The B-sharp movement is what I gave you, these guys. Creatinine kinase. The creatinine kinase is elevated, and then they have muscle weakness. Those are the good B-sharp movement that you have to know. These are also okay. Teaching grapefruit juice and fiber, they're okay. But these are some things that you have to know about this medication. It's a straightforward, simple, straightforward medication that you have to know. It's a statin for the NCLEX, but I call it Rosuvastatin. So let's show you two questions that are related to this fact. One of them, a client taking simvastatin report muscle pain, dark urine. I told you which laboratory test should the nurse suspect the provider to order. The key fact, muscle pain, dark urine. Think about myopathy and rhabdomyolysis. Those are the two things. AST, ALT, they will deliver. It's not a priority. Hemoglobin, hematocrit, that's bleeding. It's not the problem. Blood glucose is going to be elevated, like I told you, it's not a problem. But creatinine kinase elevation, that's my rhabdomyolysis. So the answer choice is 3. Number 4, a nurse is teaching a client newly prescribed atorvastatin. Which statement by the client indicate a need for further teaching? I will take my medication at 9 before bed. That's a good thing because cholesterol is made at 9. I need to avoid eating grapefruit juice while taking this drug. Yes, it's very good. If affect production of that and then action of the medication. If I get pregnant, I should stop the medication right away. It's a teratogenic. You should not take it. Last one, therefore, has to be the answer. If I have mild muscle soreness, I will just continue the medication. No, muscle soreness is rhabdomyolysis. You need to call your doctor to stop the medication. Otherwise, you're going to be in trouble. Need further teaching? Number 4. This is Rosuvastatin, starting for the NCLEX. Thank you for watching. Have a good day.